surgical specimen showed moderately differentiated. We see this sometimes. It's not a good sign. So the biopsy, the tissue under the microscope changed from moderately to poorly differentiated. The third biopsy was done in June of 2011 and confirmed the persistence of now poorly differentiated cancer. This is a terminal illness and will cause the death. It is not a salvageable situation in a patient like Ms. Reimer. The other terminal illness she had that would cause her death, with or without adenocarcinoma, is dementia. Dementia is a terrible disease. It's one of the most common causes of death, especially in people who are older. Dementia in a younger patient is more rapidly progressive and has an earlier death than in an 80-year-old. An 80-year-old with dementia may live 4, 6, 8 years, maybe longer. But a 50 or 60-year-old with dementia, that is a different matter.
Well, Dr. Jones, how do you know that these are terminal illnesses? What evidence do you have to share with this jury that those are terminal illnesses for Mrs. Reimer?
Well, these terminal illnesses have manifestations, and these manifestations emphasize their terminal nature. One quality is the fact that over time, her laboratory changed. Doctors are very interested in laboratory tests. We love to take lab. You go to the doctor, they want to take lab. You have cancer, they want to do lab. What does the lab tell you? It tells you the prognosis. It tells you what's happening. From 2008, when she first started having vaginal bleeding, her lab was good. Her hemoglobin was part of the blood count was 14.5 or 8. With each subsequent year, her hemoglobin fell every year. From 2008 until in January, February, it fell down to a low of approximately 7. And the hemoglobin 7 sometimes is transfused, these days less so.
What's the significance of that drop, Doctor? What is that?
She wasn't bleeding copiously, but there was something going on inside her body that made it impossible for her to have a normal blood count. And what was that thing inside her body? It was cancer. Cancer inside the body that is killing you does it in many different ways, but the most important for in this case is the idea of disease. The cancer, the abnormal tissue it creates, it's bathed in our body's blood and fluids, and it releases chemicals called cytokines. Why is it when somebody has cancer they feel so bad? Is it because they've got something in their kidney? No. It's because they have something in their kidney that's secreting chemicals that go throughout their body and destroy their health. This is how cancer, even though it may be relatively small, like a small cancer in the kidney, can be a cause of death.
Now, Doctor, were there any other labs that were indicative of this process?
Another important laboratory is your albumin. Albumin is a protein in the body. Albumin is part of what we call acute phase reaction. Okay, albumin represents how hard the body is fighting to survive. Any of us, if we're in a suddenly facing a life-threatening illness like a terrible automobile accident, the albumin in our blood will rapidly fall and be replaced by proteins that are needed to survive. These proteins are generally called acute phase reactants, and that's how doctors talk about it. And her albumin, when she started, and I have my notes in front of me, but approximately 4.5. And by January, it had fallen to less than 1.5. Later, it was 2.4. Each year it fell. It didn't just fall all of a sudden. Each year, from 2008 to 2009 to 2010 to 2011 to 2012. Each year, worse than the year before. This is a terminal illness rapidly approaching its conclusion. There are other manifestations of terminal illnesses. Doctors like to see patients. They take a look at them and they say, this is what we're going to do for you. This is what I think we need to do. Two doctors, multiple doctors I should say, looked at Miss Reimer, said, we have faced a terrible situation. This first became apparent in the fall of 11 when the dear old psychiatrist no poor prognosis. And then later, when Dr. Mattei saw the patient in the hospital, doctors, and said, hospice. And when Dr. Gagadam, or one of the other doctors wrote, Dr. Phillips, there is no hope for meaningful recovery. These doctors all recognized the seriousness and determined the terminal nature of her illness.